Welcome to today's PAWSCAST.
Hi everyone, I'm Dr. Amanda Vandeveer and I work as the field director for our social work department here at Frostburg State University. And today we're talking with Dr. Susan Mandell, clinical director of the Student Counseling Center here at Frostburg State University, about ADHD. And that's definitely one of the topics near and dear to my heart because I have ADHD. And the funny thing is, when I'm out and about in the world and talking to people and I say, oh, well, I have ADHD, so I did this or I forgot this or, so I have a lot of people replying back, oh, I have it too. So it seems like it's becoming more recognized or maybe more prevalent. So can you tell us more about that?
Mm-hmm. Absolutely. So great points. First of all, the prevalence of ADHD isn't necessarily changing. However, there does seem to be less stigma around the acknowledging ADHD, which seems to make it seem more prevalent, right? Yeah. I also think that we're getting a little bit better at not missing people who have ADHD. So there are a couple of different types of ADHD. There's the hyperactive type, the inattentive type, and the combined type. And it's really that hyperactive or combined presentation that has been most typically or most frequently recognized because we can see that when somebody is having a hard time sitting still, is impulsive with their behavior. That's much more noticeable, particularly to teachers in the educational environment. And so that has tended to be more recognized and diagnosed. And it's also been more recognized and diagnosed in boys as well. So what we're seeing in the history is that girls have been much less diagnosed, and we're seeing that now looking back as adults, females are coming to the realization of like, oh, I struggle with some of these things, but it's never been recognized for many reasons. Maybe because as a girl, I knew I had to sit prim and proper and pay, and you didn't have those behavioral issues, but you may have had the distractibility and the difficulty concentrating. So it is becoming more frequently diagnosed in girls as well as in adults later in life who are saying like, I'm still struggling with these things. This hasn't gotten any better.
Yeah, that's interesting. So what does it feel like to have ADHD compared to a person who doesn't have it?
Okay, so like I said, there's a couple of different types. So it might show up differently for people. But the most common things that we see are things like difficulty concentrating, difficulty with organization, difficulty with time management, difficulty finishing projects, starting projects. In everyday life, it might look like your space is also always very messy or disorganized. You might have difficulty with things like doing meal preps, paying bills on time, those sorts of daily tasks. Again, in school, you might see some academic or behavioral difficulties, and then later in life, those could potentially transfer over to the work environment. And then finally, many people with ADHD have a higher tendency of irritability and difficulties with emotion regulation.
Yeah, that makes sense. So how does, you mentioned like it can affect people in school and work. So how does it affect people in like school, work, relationships? Like how does that impact them?
So I think the most common thing that we think about is difficulties in school for people with ADHD because we're asking you to do things that are naturally very, very difficult to do. We're asking you to sit still, pay attention, maintain your concentration, not move around or fidget, and those things are going to be really hard for a person with ADHD. And then outside of that, we can see things with difficulty with, again, organizing themselves in order to be able to start a task, stay focused on that task until task completion. They can have difficulty with again, that procrastination, waiting until the last minute to start something. So those are typically the things that we're going to see in the school environment. And again, that can also transfer over into work difficulties. So maybe getting to work on time is hard. Getting work tasks done on time, maybe responding late to emails. And then as far as in relationships, again, those feelings of irritability could come up, causing some interpersonal conflicts. Your friends or partner could get really frustrated with you for never being on time, and they may see that as a reflection of how you feel about the relationship when really it's not. It's just that is just something that is difficult for you in general.
Yeah, and the time thing is an issue for me. Like, I know when all of my family members' birthdays are, I just don't know what today is. That's the thing right there. So I have to be very mindful about that. So what does it look like from other people's perspective? You were talking about how someone might perceive it as you're not prioritizing them. Are there any other ways that can come in?
Yeah, unfortunately, I think that does happen quite a bit for people with ADHD, particularly if it's untreated, particularly if it's not diagnosed.
Yeah.
And they just get labeled in a lot of negative ways. So they might be called things like lazy, ditzy, flighty, airhead, all of these really negative connotations. They could be assumed to be untrustworthy. And again, this is a disorder where it's really visible, right, to other people. They can see the impact of it, but maybe not understand the reason for it. And so all of these negative characteristics get attributed to that person. They can be seen as really a bad person without good morals or values, when that's certainly not the case at all.
Right. And the thing is, remembering, like, this is my normal. So I think I'm doing things, but that's normal to me.
Right.
It's not necessarily normal to someone who's neurotypical.
Right.
Yeah. So what are some of the most effective coping mechanisms that people can use?
Yeah, so again, this is going to be really based case by case, individualized based on what that person's personal difficulties are, because it can look different for everyone. So someone who struggles with hyperactivity might really benefit from, like, having a fidget spinner or some type of sensory thing to kind of fiddle with, play with, so that they can keep themselves distracted in that way, give their brain what it needs, that movement, without being distracting to the environment around them. Someone who struggles with organization and timeliness, they might really benefit from having routines that they kind of know, like, okay, this is what I do in this order, in order to keep them on track. Setting reminders for themselves, automatic bill pay, godsend, right?
Yes.
Like, setting it up so that your bills get paid. You don't have to be remembering that my bill is due on this day. And then, of course, working with a therapist can be really helpful to figuring out what your unique needs are and kind of collaborating with that person to help figure out what the best strategies are for you.
Yeah. And what other treatments are available? You mentioned therapists. I know medication is an option too.
Yeah, medication has really been shown in the research to be the first line of treatment and most helpful treatment for people with ADHD. Again, there's no one size fits all, so it can take some trial and error figuring out which medication, what's the right dosage, extended release versus multiple dosages. There's lots of different, ways that you can do medication. And that should be done with a doctor and figuring that out, of course. And then, again, that combination of medication and therapy can be really helpful. So you're helping your brain to be able to function the best that it can, and then you're also supplementing that with these different strategies that you're working on with a therapist.
Yeah, okay. So how can someone help someone who experiences ADHD? Help me.
So really, I think the most important thing is to just be kind and supportive, to be non-judgmental. If you notice somebody struggling, reach out, ask, are you okay? Can I help you with this? Do you know that this is happening? Do you realize that you've been late, these last couple of times that we made plans, and that really didn't feel good to me? But in a non-judgmental way, not assuming the worst of the person, right? And not making hurtful or shameful comments to them.
Yeah, and I know I so appreciate when someone gives me a reminder or redirects me, like, hey Mandy, you've wandered off topic. We were talking about this. Like, I am completely okay with that, and that really is helpful for me. And that shows that they're caring towards me. So I do appreciate that.
Right. And that's a perfect example of, you can give a person that feedback without being hurtful.
Right, absolutely. And I think often people are concerned, like, oh, I don't want to hurt their feelings. But if you do it in a nice way and out of love and compassion instead of judgment, it definitely comes off that way. So yeah, what are some resources on campus to help with ADHD?
Okay, so if you already have a diagnosis, it can definitely be helpful to connect with the Student Accessibility Services Office. They'll help you determine if you qualify for any accommodations within the classroom or within the university setting. And then, of course, the Student Counseling Center is available for help. We help students with ADHD all the time with figuring out, like, okay, how is it impacting you specifically, and making sure that we meet those needs specifically.
Yeah. And what are some more resources in the community that our community members could take?
Great. So the first thing, if you don't have a diagnosis yet, but you think that you might have ADHD and you come into our office, we can help connect you with the office down at the UPMC Western Maryland. And they can do an assessment for you, okay? So it's a little bit different because it's not, usually our services are free, included in, your tuition and fees. If you go down there for an assessment, there is a little bit of a charge, but they're very good at working with you to, provide financial aid or go through your insurance. Otherwise, there's lots of great resources on our website. We have frostburg.edu/SCC has lots of resources on ADHD, websites with lots of great information. There's also lots of groups that have social media sites. So CHAD is one in particular. It's a Child and Adults with ADHD organization. They have a Facebook page where they're always posting information about, new research, new treatments, what's going on. And then finally, there are lots of apps that are coming available now where, again, setting reminders for yourself, helping you stay on task, and those are all available online now.
Yeah, my Google Calendar is a lifesaver. Back in the day, the daily planners that they'd hand you, they got put in a drawer and never came out until the end of the semester.
Right.
So, the Google Calendar on my phone has been so helpful for me. So is there anything else you would like to add today?
Yes, I would like to just say that one of the biggest things about ADHD is that there's been so much stigma and misinformation about ADHD, particularly about medication. Medication is really the most effective treatment that has been shown to improve concentration, reduce distractibility, and reduce impulsivity. But I often hear people coming into the office saying that they have concerns about using medication, particularly, a medication that they'll probably have to be on for the rest of their life. ADHD is a lifelong disorder, right? It's not something that you're going to be able to grow out of. It might change what it looks like over the course of your life, but will always be something that impacts you. And there should be no shame in getting treatment for that. Right? The brain is an organ of the body, just like the heart or the liver. If you needed a medication for the heart, I never hear anyone saying, why do I need this? I shouldn't have to take this. My heart should work better. But I often hear that about our brain.
And nobody says, well, just write it down in a calendar.
Your
heart
to work better, right?
No, that never happens.
No, never. Right? But we get all of these shaming messages about having to take medication for ADHD or other mental health disorders. So, we're trying to reduce that stigma is really important to me. And then the other concern I hear about medication is people worried, that it's going to cause addiction issues or substance use issues. And again, the research has really shown that the appropriate use of medication can actually reduce substance use disorders and reduce addiction issues. So, of course, we don't want to misuse a medication that we don't need that medication. That's not appropriate. But if you have ADHD, then the use of that medication is appropriate and can help you have better long-term reduction of symptoms.
Yeah, absolutely. And one thing I would like to add, just because you have ADHD doesn't mean you can't. I'm a living example. You can. You just have to learn the coping skills, get the treatments you need, find the help and the accommodations that you need, and you can achieve.
Absolutely.
So it's not something that's going to prevent you from being able to live a happy, productive, healthy life.
Right.
So thank you for taking the time today to speak with us about ADHD, Susan. I really appreciate it. And as always, the Student Counseling Center and the SAFE Office are here to help you if you find that you need assistance. So please reach out. Thanks for watching today, everybody. Bye-bye.
Thank you for being a part of our PAWSCAST. This health and wellness podcast is brought to you by the Prevention Center and Peer Education Network at Frostburg State University. If you would like more information about our programs, visit us in Pullen Hall, room 109, or call us at 301-687-4761. Or you can always send us an email at safeoffice@frostburg.edu. Remember to watch our other episodes and stay tuned throughout the semester. Thank you!